Bell's palsy. Symptoms of Bell's palsy include sudden weakness of the facial muscles. In most cases, the weakness is temporary and will improve within a few weeks. Weakness with which half of the face seems to be frozen. Your smile is one-sided, and your eyes on this page are resistant to closing. Bell's palsy, also known as acute peripheral facial nerve palsy of unknown cause, can occur at any age. The exact cause is not known. Most likely, this is the result of swelling and inflammation of the nerves, muscle failure on one side of the face. Or maybe it's a reaction that occurs with a viral infection. For most people, Bell's palsy is temporary. Symptoms usually begin to improve within a few weeks, with full recovery taking about 6 months. A very small number of people have some of the symptoms of Bell's palsy for life. In rare cases, the paralysis may return. Symptoms: if symptoms of the disease appear, the phone turns on suddenly, and may contain any of the following actions. Rapid onset of mild weakness to complete paralysis on one side of the face within a few hours or days. Saggy faces and difficulty with facial expressions, such as closing your eyes or laughing. Excessive salivation, pain around the jaw or in the ear on the affected side. Hypersensitivity to sound on the affected side. Headache. Loss of taste. Changes in the amount of tears and saliva that produces. In rare cases, the lesion can affect nerves on both sides of the face. When to see a doctor: contact your doctor immediately if you have something like paralysis, because he may have had a stroke. Bell's palsy is not caused by a stroke, but it can cause similar symptoms. Please consult your doctor if you experience facial weakness or droop to find out the underlying cause and severity of the condition. Reasons: although the exact cause of Bell's paralysis is not fully clear, it is most often due to a viral infection. Viruses that have been linked to Bell's palsy contain viruses that cause cold sores and genital herpes, herpes simplex, chickenpox and herpes zoster, shingles, infectious mononucleosis, Epstein-Barr, cytomegalovirus infections. Respiratory diseases: adenoviruses, rubella of mumps, mumps virus, flu, hand and foot disease, Coxsackie virus. The nerve that controls your facial muscles is a narrow corridor with bones on the way to your face. When Bell nerve palsy, inflammation, or swelling occurs, it is usually due to a viral infection. In addition to the muscles of the face, tears, saliva, taste and a small bone inside the ear also affect the nerves. Risk factors: Bell's palsy is more common in people who, during pregnancy, especially in the 3rd trimester of pregnancy or during the first week after delivery, and have an upper respiratory tract infection, such as the flu or a cold. Diabetes mellitus. Recurrent attacks of Bell's palsy are rare. However, in some of these cases, there is a history of recurrent seizures, which proves that there is a potential genetic predisposition to diseases during Bell. Complications: mild cases of paralysis usually resolve within a month. Recovery from a serious accident in which complete paralysis occurs. Complications may include permanent damage to the facial nerve, abnormal growth of nerve fibers. This can lead to involuntary contraction of some muscles, and when you try to switch to others, synkinesis. For example, when you smile, the eye on the affected side may be closed. Partial or complete loss of vision in the eye, which does not close due to excessive dryness and scratches of the transparent protective outer layer of the eye, cornea.